The following presentation has been produced by Electrolysis Research Corporation, located in Fond du Lac, Wisconsin. Electrolysis Research Corporation is dedicated to the advancement of electrolysis as a profession through basic research and the production of educational materials. This topic will be discussed by Dr. James Shuster, a well-known lecturer in the field of electrolysis. Dr. Schuster's credentials include training in electrical engineering and medicine at the University of Wisconsin and dermatology at the University of Michigan. Dr. Schuster is a board-certified dermatologist and licensed electrologist practicing in the state of Wisconsin. We are indeed pleased to present this unique educational opportunity.
In this video presentation, our topic is thermolysis. Thermolysis as a means of permanent epilation has been used since the 1920s and today enjoys the title of most widely used modality, especially when you consider its use in the blend technique. In our order of presentation, we will first discuss basic concepts of high-frequency current so we have a clear understanding of how and why it affects human tissue. Next, we will study by means of a high-frequency analog model the important variables that pertain to the use of thermolysis. Lastly, we will show thermolysis in action by means of microscopic video observation. This has never been shown in the past, and I think you will find it quite exciting. Using this format, we hope to provide you with a broader awareness of the many parameters that need to be realized and understood in order to be a truly professional electrologist and to practice thermolysis to its greatest advantage. The student of electrolysis, and students we should all be until the day we retire, soon learns that there are a number of confusing terms for the modality currently called thermolysis. These terms are thermolysis, which is a hybrid term derived from therm referring to heat and lysis referring to dissolving. High frequency, which refers to the frequency of the alternating current that we use, namely between 3 and 30 million cycles per second, or megahertz. AC, or alternating current, which refers to the fact that the current changes polarity, and all high-frequency current is alternating current. Short wave, because high-frequency current has a short wavelength. Diathermy is an old term that goes back to the early part of this century when high-frequency current was referred to as diathermy. Occasionally you'll see this term in older textbooks, and it is rarely used today. Radio frequency is another term that's used because the type of electric current we are using can also be used to send radio signals on, and electrocoagulation because we're basically coagulating tissue by means of electricity. All 7 terms are accurate, but for this presentation we will use the term thermolysis. When talking about the type of electric current used for thermolysis, we will use the term high frequency. Let's briefly define high-frequency current and examine its characteristics. High-frequency alternating current is defined as an alternating or oscillating current in the frequency range of 3 to 30 megacycles. This means that the electric current changes polarity from positive to negative between 3 and 30 million times each second. In thermolysis, we use a frequency of 13.56 megahertz, which is set by the Federal Communications Commission, or FCC. Now, there's almost something magic about high-frequency current and its ability to cause heat in polar molecules such as water. Let's examine how this can occur. In the diagram, we see a single atom composed of a positively charged nucleus and a negatively charged electron which orbits around the nucleus, similar to the Earth orbiting around the Sun. When this atom is exposed to a strong electromagnetic field, like that produced by high-frequency current, the atomic particles begin to vibrate. If we keep in mind that like charges repel and unlike charges attract, It is easy to see that when the high-frequency current is positive, it will attract the negatively charged electrons and repel the positively charged nucleus. And when the high-frequency current is negative, the opposite occurs. This constant changing of polarity, 13.5 million times a second, pushing and pulling on the atomic particles, causes a vibration which in turn produces heat. Now we know water is a molecule easily vibrated by high-frequency current. We also know that the human body is composed of over 70% water. Therefore, it is easy to see how human tissue can be heated when high-frequency current flows through it, and how we as electrologists can take advantage of this characteristic. Let's look at another characteristic of high-frequency current called capacitive return. Did you ever wonder why a grounding wire or indifferent electrode is necessary with galvanic electrolysis, but only one wire is necessary with thermolysis? The reason for this is called capacitive return. High-frequency current has the ability to travel through a relative non-conductor, such as air, to complete the electrical circuit. Galvanic or direct current behaves differently and requires a wire, which is a conductor, to complete the circuit. When using blend, the ground wire or indifferent electrode is necessary because the galvanic portion requires it. It does no harm to use an indifferent electrode with thermolysis if you prefer. Anyone who has touched a hot burner on a stove knows that heat has a profound effect on human tissue. This diagram reveals these effects in relation to specific temperatures. We all know that the normal body temperature is 98.6 degrees Fahrenheit. This is the temperature in which human tissue functions best. When the tissue temperature is increased to 105 degrees Fahrenheit, some of the more sensitive cells, such as those found in nerve tissue, begin to malfunction, but return to normal if the temperature is brought back to 98.6. If the temperature is raised to above 110 degrees Fahrenheit, but below the boiling point of water, tissue coagulation occurs, which produces irreversible damage to tissue proteins, resulting in death of cells. Coagulation of tissue is what we want to achieve with thermolysis. When the tissue temperature is heated above the boiling point of water, salt water in the case of human tissue, steam is produced which removes the water from the tissue, resulting in dry or desiccated tissue, hence the term electrodesiccation. Further heating will not only boil the water out of the tissue, but can actually cause charring at much higher temperatures. Thermolysis concepts that are important to understand are temperature gradient and point effect. Unlike galvanic current and ordinary house current, high-frequency current likes pointy surfaces. It seems that high-frequency current is most intense at points, and this is just a characteristic of this type of current. In thermolysis, we call it the point effect and are able to use it to great advantage. In the drawing, we see an example of the tissue temperature around the tip of a probe. Before the current is turned on, all of the tissue around the probe is at body temperature, 98.6. After the current is turned on and a pulse of high-frequency current is delivered to the tissue heats up to temperatures similar to those portrayed in the diagram. The closer to the probe tip, the hotter the tissue is heated to. And if you go far enough away, there is essentially no heating. Now there exists a zone within this heating pattern that I refer to as the critical zone. Outside this zone, the temperature is not high enough to destroy tissue, and within the zone, it is hot enough. Of course, if you want to destroy the dermal papilla, it must be entirely within the critical zone, seen in red. As you can see, the critical zone for thermolysis is drop-shaped, with the probe point in the center. If you want to prevent regrowth, it's important to have the probe tip as close to the dermal papilla as possible. If the dermal papilla lies within the yellow zone, it will be heated somewhat, but not hot enough to cause permanent damage. If we look back at our point effect temperature diagram, we see that the temperature is over 200 degrees close to the metal probe tip. If high intensity and/or high timing is used, this temperature can easily reach the boiling point for tissue fluid, which is slightly over 212 degrees. When the boiling point is reached, steam is produced. In this diagram, you can see the rapidly forming steam, which is not a good conductor of electricity, surrounding the probe tip. Because the current can't pass efficiently through steam, it is conducted through cooler tissue higher up on the probe. Of course, you want the maximum heating pattern at the tip near the dermal papilla and not higher up near the skin surface where it can cause pitted scarring. This brings up another thermolysis concept called high-frequency blowout. The term we use for significant amounts of steam being produced at the hot probe tip is high-frequency blowout. This occurs when the intensity and/or timing are set high and the tissue fluid is rapidly heated to the boiling point. Steam is produced so rapidly that it actually explodes within the tissue, causing a crackling sound. Also, as all the water is boiled out of the tissue, it frequently sticks to the probe, similar to an egg sticking to a hot frying pan. The worst part of high-frequency blowout is not the crackling or the sticking, but the transfer of current conductivity higher up on the probe, which heats up and damages the tissue near the surface and can result in pitted scarring. The other negative effect is that less current is conducted into the tissue at the tip, causing a narrower critical zone, and therefore less chance of destroying the dermal papilla. Another way to think about this concept is to consider the pulse of high-frequency current. It has to go somewhere. Now, if the current cannot get through this steam bubble here, it can be more easily conducted into this tissue higher up, which doesn't have steam surrounding it. Needless to say, we should try to avoid high-frequency blowout. There are several ways to recognize and prevent high-frequency blowout. Proper selection of timing and intensity is one way. Although both timing and intensity contribute to the amount of heat produced, high-intensity settings are especially apt to result in high-frequency blowout when the timing is not kept very short. Avoid crackling, blanching, and burnt material on the end of your probe. If any of these phenomena occur, you can almost be assured of high-frequency blowout occurring. Be knowledgeable of your epilator and its capabilities. Each high-frequency or blend epilator has definite timing and intensity ranges for thermolysis. These ranges will determine your flexibility with regard to timing and intensity in preventing high-frequency blowout. Consider other variables such as depth of insertion, probe diameter, and type of probe. Each of these variables, if not understood and accounted for, can contribute to high-frequency blowout, as we will see later in this presentation. One last concept that I'd like to mention is current density. Current density, at least as it pertains to electrolysis, is the amount of current or electrons flowing out from a given surface area of a probe. To further explain current density, let's look at three square wires or conductors. The wire on the left is 4 inches square and the two wires on the right are 1 inch square. Because the same 20 electron current is flowing in the wire on the far right and wire on the far left, you might think the current density might be the same, but this is not true. With the wire on the far right, all 20 electrons must flow through an area that is only 1/4 the area of the wire on the left, so the current density is therefore 4 times that in the larger wire. For the small wire to have the same current density as the larger wire, you would have to decrease the current to 5 electrons as seen in the center wire. Understanding current density is important in order to understand what happens as we change intensity, depth of insertion, and the other variables. Think of 100 people running through a subway tunnel and 10 people running in a similar tunnel. Certainly more heat is going to be generated by the 100 people cramming together and rubbing shoulders in the tunnel with 100 people. So it is with electrons and current density. Whenever a complex phenomenon is to be examined, such as the high-frequency heating pattern, a well-thought-out experimental procedure should be used. It is also important to think of all possible variables, which are factors that can affect the high-frequency heating pattern, and test for only one at a time, keeping all the others constant. We decided to use the egg white analog model because it is simple, easy to photograph, and readily available. The variables which will be discussed in this presentation are timing, intensity, probe depth, probe diameter, pulsing, and type of probe. Timing can be defined as the length of time that the high-frequency current flows from the probe into the tissue of the hair follicle. Timing is usually measured in seconds. The length of time that the electric current flows can be determined by two means. Automatic timing, this is where the epilator electronically times the high-frequency pulse. The advantages of automatic timing include that it's more accurate, it's repeatable, it's necessary for high-intensity short timing electrolysis, such as that used in the flash method, and it should always be used by new or beginning electrologists. Manual timing also has advantages, and these include allowing longer timing in machines with short automatic timing ranges. To explain this, we could say that some electrolysis machines only have automatic timing that goes up to a half second. Now, if we want a 2-second pulse, the only way we could do that is to have 4 half-second pulses, which would equal 2 seconds, or use manual timing where you could judge with your mental timer approximately what 2 seconds would be. Another advantage is that it allows more flexibility in treating each hair. By this I mean you can give a little extra timing in hairs that might be thicker or deeper by merely keeping your foot on the foot pedal a little longer. One caution I should give, however, and that's don't overestimate your brain's timing. It can never be as accurate as an electronic timer. Let's take a look at how current density relates to timing. Actually, current density doesn't change at all as timing is increased or decreased. Current density stays the same. Despite the fact that the current density does not change as time increases, the tissue does get hotter. This is because the atoms in the tissue are vibrated for a longer period of time. An example would be when two sticks are rubbed together. Even though you are rubbing them back and forth at a constant speed, the longer you rub them, the hotter they get. So it is with thermolysis. The longer the timing, the hotter the tissue gets. In addition to the vibration, there is electron flow also, as seen in the diagram. The longer the current flows, the more electrons flow through the tissue, also contributing to heat production. Here you can see that the only difference between these two probes is that this one is on for 1 second, this one is on for 2 seconds. The current density is the same number of electrons are flowing out of a square surface area of each probe, but this one being on 1 second, a certain number of electrons are allowed to flow out of the surface area, but because this one is on twice as long, twice as many electrons flow out. In this view, you see multiple photomicrographs of the analog model. The only variable that is changing is timing. All the other variables, such as intensity, depth of insertion, are constant or not changing. Again, we can see that with a short amount of timing, there is only a small pattern. As more and more timing is used, the pattern subsequently gets larger. Here we see the same thing with an insulated probe. Very little heating pattern here, and the heating pattern just keeps getting larger and larger as the timing is increased. Let's take a look at one of our analog experiments showing timing. Soon you will see the high frequency heating pattern. There it goes. You can see it getting wider and wider and wider. A nice bulbous pattern without any high frequency blowout, with the widest pattern down at the tip. Soon we will see another pattern with a little lower intensity. Here we see the probe before current. Now we see a nice pattern beginning, and again you can see that as timing increases, the pattern gets wider. Current intensity is defined as the strength of the current. It is usually measured in mA or milliamperes. Treatment intensity can be varied by turning a dial or programming a particular intensity into your computerized epilator. Let's examine intensity in relation to current density. By examining the diagram, you can see that 3 times as many electrons are coming out of a given area of the probe into follicular tissue on the 3 milliampere probe compared to the 1 milliampere probe. The fact that 3 times as many electrons are flowing into the tissue means that the tissue will be significantly hotter than the 1 milliampere probe. Hence, if you increase the intensity, the probe gets hotter. If you want your probe to be hotter, the most effective way is to increase the intensity. Although increasing the timing will also make the probe hotter, increasing the intensity will do it better. On the other hand, if your probe is too hot, try to lower the intensity first. Be careful not to decrease the intensity too much, because very low intensities will not produce a point effect, and the current will be conducted higher up in the follicle and not down at the dermal papilla where you want it. Let's examine intensity with the analog model. As you can see, when the intensity is increased, the heating pattern also increases. However, when the intensity gets too high, the heating pattern begins shifting to higher levels on the probe, causing a wider heating pattern where you don't want it. The reason for this is high frequency blowout. Steam is produced around the tip, which acts as an insulator, transferring conduction closer to the surface. Here you can see that with very low intensity, there is little or no pattern. As the intensity is increased, the pattern gets hotter and wider. Here you begin seeing a little wider pattern higher up on the probe. Here you see a much wider pattern higher up on the probe, and this one here, which is partially cut off, you can see a very wide pattern higher up. Probably at about this point you're starting to get a small amount of high frequency blowout, and at these points a larger amount of high frequency blowout. Here we see the same thing using an insulated probe. Here we can see with lower intensities a smaller pattern, larger and larger and larger. And then we can see here as the pattern or as the intensity gets significantly higher, the pattern actually gets smaller, and that's because steam is produced and the electricity cannot transfer into the analog as easily. And of course this happens in tissue as well. Now we'll see an example of high frequency blowout. Now you can see the pattern beginning. You will soon see it begin blowing out at the tip. There you see it. Now as additional pulses are given, the pattern begins climbing up the probe with little or nothing being done down at the tip. After this, we'll see an example of normal thermolysis. You'll see a nice pattern beginning at the tip and staying at that point on the probe. You don't see much climbing up the probe as you did after the high frequency blowout occurred. Depth of insertion can be defined as the distance to which the probe is inserted into the follicle. Let's examine how current density is affected by depth of insertion. Let's assume that for every pulse of current delivered to the probe, there are 1,000 electrons that must flow from the probe into the follicle tissue. If the entire probe is in the follicle, the electrons have the full surface of the probe to exit into the tissue. If the probe has a surface area of 10 square millimeters, then 100 electrons, or 1,000 divided by 10, come out of each square millimeter of the probe, causing a current density of 100 electrons per square millimeter. If you pull the probe halfway out and deliver a pulse of 1,000 electrons to the probe, and there is only 5 square millimeters of probe surface for the electrons to exit into the follicle, so when the probe is halfway out of the follicle, the current density doubles to 100 electrons per square millimeter. Because the current density doubled when the probe was pulled halfway out of the follicle, this would be roughly the same as leaving the probe all the way in and doubling the intensity. Let's look at our analog model. Of course, all variables remain the same except for depth of insertion. You can see that as the probe is pulled to shallower and shallower depths, it becomes hotter and hotter. When it is pulled to approximately 1/2 the original depth, it becomes so hot that high frequency blowout occurs. If we were actually treating a hair follicle, that much heat high up in the follicle could result in significant surface damage and a possible pitted scar. In summary, you might say that a shallow probe is a hot probe if your timing and intensity were set for deeper follicles. Again, you can see when the probe is into a full depth, there is a smaller pattern. As we bring the probe farther and farther out, you can see that the pattern keeps getting larger, indicating greater heat. Actually, as we got out quite a distance here, to at least half the initial depth, high frequency blowout is occurring. This pattern is almost out of the field of view, so it's difficult to see, but you can see no bulbous pattern on the last one on the right. Probe diameter can be defined as the thickness of the probe. At this time, for the sake of simplicity, we will only consider the standard cylindrical probe, but the basic concept applies to all probes. Probes generally come in thicknesses from 2 to 7 thousandths of an inch in diameter. A number 6 probe would have 3 times the surface area that a number 2 probe would have. In order to understand why thin probes are hot probes, we need to again consider current density. Let's deliver 1,000 electrons to each of 2 probes. One is a number 3 probe and the other is a number 5 probe. All of the electrons must exit the probe at the surface of the probe. If the thick number 5 probe has almost twice the surface area, the current density at its surface will only be about 70% or less, as much as at the number 3 probe. Let's say this another way. If we are sending 1,000 people through 3 gates at Disney World and another 1,000 people through 5 gates in the same period of time, almost twice as many people must rush through each of the 3 gates as through each of the 5 gates. Here we have the analog model comparison of a number 6 probe and a number 2 probe. As you can see, much more heating occurs around the number 2 probe. This is the thicker probe. This is the thinner number 2 probe. You can see a much wider and denser heating pattern here as compared to the thick probe. In this second photo, you see a number 6 and a number 2 probe compared as the intensity is increased. Again, the thin probe shows much more heating pattern with high frequency blowout occurring at the highest test intensity. This you can see here, this is the thicker probe, and this is the thinner probe over here, and you can see high frequency blowout on this last pattern on the right. In summary, you could say thin probes are hot probes. It doesn't mean you shouldn't use thin probes, but rather adjust your machine accordingly. How many of you listening are tappers? By that I mean for over half the hairs you treat, you tap the foot pedal more than one time. The technical term for tapping is pulsing. We define it as 2 or more pulses of current during the treatment of a single hair follicle, or 2 or more taps on the foot pedal. Let's take a look at what actually happens from a technical standpoint. In this diagram, we see 3 different ways of delivering 2 full seconds of high-frequency current. Starting from the top, example C, we have 2 1-second pulses with a half-second interval. This treatment takes 2.5 seconds to finish. In example B, we see a single 2-second pulse. The treatment time is obviously 2 seconds. In example A, we have 4 half-second pulses with a half-second interval in between. This treatment takes 3.5 seconds. So in these 3 examples, we see 2 seconds of high-frequency current taking 2.5, 2, and 3.5 seconds to deliver. Let's take a look at what's happening in the follicle tissue by using the analog model. Here we show the results of pulsing using a number 6 probe. The pattern on the left is caused by a single 2-second pulse. The pattern on the right is from 4 half-second pulses with a half-second in between each pulse. Both treatments have 2 seconds of high-frequency current, only the one on the right has 3 half-second rest periods between the 4 1/2-second pulses of current. From this you can see that the single 2-second pulse is significantly hotter than the 4 half-second pulses, and the reason is because the tissue cools down in between each of the 4 pulses and has to be reheated to some degree. In this photo we see a comparison of pulsing using a number 6 probe and also a number 2 probe. The left-hand pattern of each grouping is a single 2-second pulse. The pattern on the right is from 4 half-second pulses. Again, the same result. The single pulse is much hotter with each probe size. There are definite advantages of pulsing. One of these is that it allows longer automatic timing when your epilator's automatic timing range is too short. Assume that the maximum automatic timing on your machine is a half-second and you want a 2-second pulse of automatic timing. The only way you can even approach a 2-second time is to give 4 half-second pulses, and even then there will be less heating than with the single 4-second pulse. Several popular epilators have timing ranges that can't reach 1 second. One other way to get longer timing in a machine with a short timing range would be to use manual timing, but this is certainly not for beginners. Another advantage of pulsing is that it's useful in the blend technique. When using blend, you usually have lots of time because the galvanic timing takes so long. Therefore, you have time to give 2 or more high-frequency pulses without wasting time. The main disadvantage of pulsing is that it slows you down. It wastes time whenever you use thermolysis. It simply takes longer when you use more than one pulse because of the cooling off time in between pulses. To equal the heating pattern of 1 2-second pulse, you might have to use 6 or 8 half-second pulses, and in some cases you will never get as wide of a heating pattern. My advice is to use a single pulse if your machine is able to give you the automatic timing you require. For those of you that pulse at different depths in each follicle, watch out for shallower depths where your probe will be much hotter and could result in pitted scarring. Probe type is of great importance when using thermolysis. To be complete, we will discuss both insulated and non-insulated probes. We will also consider the 3 main types of non-insulated probes, namely the standard cylindrical, the bulbous, and the tapered. These are the basic 3 non-insulated probes. The first is the standard cylindrical, the second is the tapered, and the third the bulbous probe. If we look carefully at their shape and consider that high-frequency current likes points, we could probably guess which one has the best electrical characteristics for thermolysis. You take a guess, then I'll tell you what I think and we'll look at the evidence. Okay, time's up. The tapered probe has the sharpest point, which would provide the best point effect. Because the probe widens higher up, the current density on the surface will decrease at higher levels on the probe. This is exactly what we want in thermolysis. High current density at the tip, low current density at the surface to minimize skin surface damage. Now look at the bulbous probe. Fat tip for less point effect, narrower blade for higher current density higher up. Just what we don't want. The standard cylindrical probe falls in between the other two with the same thickness top to bottom. So from strictly an electrical point of view, the tapered is the best, then the cylindrical, and lastly the bulbous. The fact is, however, when we test all 3 probes using the analog model, there isn't a whole lot of difference. In this experiment, only the probe type varies. The probe on the left is the bulbous probe, then the standard cylindrical, then the tapered, and the one on the right is the insulated. The heating patterns around the 3 non-insulated probes on the left are fairly similar. The insulated probe has almost no heating pattern because it was so hot that the high-frequency blowout occurred when the same timing and intensity were used as with the other 3. More about insulated probes later. Even though the heating patterns were fairly similar on the 3 non-insulated probes, there was a greater tendency for the heat to climb up the probe on the bulbous probe, seen at the far left. You can see some pattern in this area. This is the bulbous probe. You can see that there is some pattern right in this area here, showing a tendency to climb up the probe a little easier. The cylindrical and tapered probes tend to favor a little better point effect. Here we see the cylindrical and then the tapered probe over here. You can see with the tapered and with the cylindrical there isn't as much tendency to climb up as with the bulbous probe. The reason there isn't a greater difference in heating patterns is because the bulb on the bulbous probe is not very big because it has to enter the follicle, and the taper on the tapered probe is not very significant because the tip can't be too sharp and the higher up part of the probe can't be too wide. Because of these constraints on the bulbous and tapered probes, so that they can be used for epilation, all three non-insulated probes can be used successfully with thermolysis. Let's now take a close look at the insulated probe and how thermolysis is affected by its use. This photo shows a typical insulated probe. You can see the glistening non-insulated tip with the insulated shaft above. It should be noted that high-frequency current can pass through the types of insulation used on insulated probes. However, when the current is faced with conduction from an insulated and non-insulated portion of the probe, it will always be conducted through the non-insulated portion. Electric current always takes the path of least resistance, kind of like people always taking the easy way out. Let's examine current density and how it relates to the insulated probe. Simply put, if you put the same number of electrons into a regular probe and an insulated probe, they all have to flow into the follicle tissue. With a regular probe, the electrons can flow into the tissue along the entire length of the insulated probe. With the insulated probe, however, all the electrons flow out of the non-insulated portion. If the non-insulated portion represents only a third of the inserted length, the current density will be 3 times that of the non-insulated probe. As a result, if you don't change your machine's settings, the insulated probe will be so hot that high-frequency blowout is surely to occur. Now we'll watch the analog and a normal pattern of high-frequency current on an insulated probe. Next, we'll see high-frequency blowout occurring. You can see the blowout. Now, as additional pulses occur, you can see the current actually going through the insulation and causing a pattern higher up on the probe because the current can't get out at the tip because of the steam. When considering the insulated probe, we have to ask whether all the variables behave the same as with the regular non-insulated probe. With timing, there's no difference. If you turn the timing up, the current is on longer and the probe gets hotter. With intensity, there's no difference. Turn up the intensity, the probe gets hotter. Of course, keep in mind that much smaller intensities are needed compared to the non-insulated probe. With probe diameter, there's also no difference. A thin probe is still a hot probe. With pulsing, there's no difference. A 2-second single pulse is still lots hotter than 4 half-second pulses. However, with depth of insertion, there is a big difference. Let's take a look exactly what happens. Here we see an analog experiment using the insulated probe, and depth of insertion is the variable. We can see that depth of insertion makes no difference as long as all the exposed portion of the probe is in the tissue. Using the insulated probe allows you to forget one variable, and for those of you that pulse at different levels in the same follicle, you can do it safer because the probe won't get hotter as you get higher up in the follicle, thereby minimizing the chance of scarring. When we talked about variables in the insulated probe, we stated that there was no difference compared with the non-insulated probe except for the depth of insertion. This is true in the sense that if you turn up the intensity on either, they get hotter. But there is a difference between intensity and how hot the non-insulated portion of each gets. Let's compare a non-insulated probe with insulated probes manufactured by Precision and Laurier. We ran an experiment to determine what intensity was necessary to cause equal width heating patterns in a non-insulated probe a precision insulated probe, which has a small non-insulated portion, and the Laurier insulated probe, which has a longer non-insulated portion. We found that compared to the non-insulated probe, we needed only 1/3 the intensity with the precision and 1/2 the intensity with the Laurier non-insulated probes to cause the same size heating pattern. Now, this experiment was not a very precise one, but it does illustrate that you need only 1/3 to 1/2 as much intensity to make your insulated probe as hot as a non-insulated probe. Let's take a look at some rules for insulated probes. The first rule is that depth of insertion is important. Because the destructive potential with thermolysis, galvanic, and blend is only available at the non-insulated tip, the tip must be precisely at the level of the bulb and the dermal papilla. Also, it is important to use less intensity and timing in both thermolysis, galvanic, and blend. Approximately 1/2 the destructive energy will be required compared to the non-insulated probes. If a crackle is heard with thermolysis and blend, the probe is too hot. Turn down your thermolysis timing and/or intensity. If debris sticks to the end of the probe with thermolysis and blend, the probe is too hot. Turn down your thermolysis timing and/or intensity. Check the condition of the insulation. Insulated probes are not as durable and rugged as regular non-insulated probes. Occasional checks using a magnifying glass or microscope are helpful in assessing the condition of the probe. Cleaning and sterilization. Cleaning with an ultrasonic cleaner is advisable. Sterilization using a gentler form of sterilization, such as oven sterilizer or autoclave, will add to the useful life of the probe. Definitely don't use a bead sterilizer. These generally are not accepted in electrolysis anymore, but the real high heats could have an adverse effect on the insulation on your insulated probe. At this point, we will look at some of our microscopic video experiments. We'll look at probing of human follicles, and then we'll actually see thermolysis in vivo, which means in live human tissue. We'll now examine how follicles are probed using fresh human scalp tissue. You can see the probe is penetrating the follicle. You can see it probing at the bulb area. You can see it tending to distend the bulb area. Now, as we come in a little closer and turn up the light, you can see that the probe slides very easily through the external root sheath. You'll see it again begin to probe, and the next time it'll actually go through. You see it actually penetrated the dermal sheath of the lower part of the bulb area. Here again you see the probe tending to probe the follicle. You can see the distension of the bulb area. You can actually see the probe turn around in the follicle, as we'll see shortly. Right now it's showing the distension. In this photo we have a little greater magnification. You can see the probe right at the tip of the follicle. You'll see it retract and probe again. You can see how easily the probe moves up and down in the external root sheath. The yellowish glistening material around the follicle is subcutaneous fat. You can see the glistening fat globules. You can see how flexible the end of the follicle is and how easily the bulb area tends to flex as the probe goes in and out. Here again we can see the probe coming down to the end of the bulb area, and if you have a very sensitive touch and a probe that isn't too sharp, in some cases you might actually be able to feel as the probe gets to this very slight resistance at the end of the follicle due to the resistance of the dermal sheath. Here we see a follicle with a probe in it, and shortly you'll see current actually turned on with thermolysis. Here you can see it. Every time the screen changes color slightly, a pulse of high frequency current is being given. You can see how the follicle is kind of shriveling up at the end and kind of moving and coming together, just like a piece of meat tends to shrink up after it's been cooked. And you can see that successive high frequency pulses cause more. Now here we have an insulated probe in a follicle, and we're just getting focused here. And you'll see as the current is applied that there'll be considerable change. There we had a flash type of application of high frequency current, and you can see that the end of the follicle is very quickly cauterized. Here we have another insulated probe down in the end of typical anagen hair follicle from the scalp. Again, you can see the effect of the high frequency current. You can see the cauterization of the follicle tissue. You can even see some of the follicles nearby moving. Here again we have an insulated probe, and you can see that when the current is turned on, again there will be a significant change. And here we see successive pulses, and there we see the last pulse actually blew the bulb area up above the probe. Again, we have a regular probe in a anagen hair follicle from the scalp, and there the current is being applied. You can see the effect of the current. The tissue around the probe is becoming cauterized or denatured due to the heat. You can even see the adjacent follicles being distorted due to the changes caused by significant heat production. Now, this might not occur quite as much in the normal skin because this is just a small piece of tissue. Here we have an insulated probe, and the current is being turned on. You can see the changes in the bulb area, again, as the pulse continues to go on. And you can see how the bulb has been kind of cocked over towards the probe due to the cauterization from the heat. This ends the formal portion of the video presentation. Because our tape length is limited to 60 minutes, we have not been able to cover all aspects of thermolysis, but rather we have tried to present some of the facts that are not available elsewhere and allow you to actually peek in the follicles as thermolysis is used. As you have just seen, thermolysis works. We have discussed the theoretical, we have confirmed our thoughts using an analog model, and we have proven without a doubt using fresh human scalp follicles that thermolysis is capable of permanently destroying unwanted hair. Of course, further verification comes from almost 70 years of clinical history where untold thousands and probably over 1 million grateful patrons have had successful permanent hair removal. For those of you watching that require additional proof, we have done extensive histologic studies that further confirm the effectiveness of this modality. I hope that after watching this video presentation you have become more aware of the different variables that affect the outcome of your work. The truly proficient electrologist looks at every hair she treats, making sure that thermolysis is being used to its greatest advantage to provide the best chance of permanent hair removal. In closing, we at Electrolysis Research hope that you have enjoyed this video production. Thank you.